Let's speak to Dr Dan Poulter, who is the co-chair of Keep Our NHS Public, not only a person that has dedicated their life, John, to the NHS, but wants to make sure that many more after you do the same. Good afternoon to you.
Good afternoon, Ian.
Nice to have you with us. We keep hearing, and you'll be familiar with this. Obviously, the NHS is great, but it's not a religion. We shouldn't treat it as a religion. It's a department we pay squillions and squillions and squillions of pounds for, but it does need a change in the way it works. Is that true, or is that a big fat urban myth?
No, there's an element of truth in that. I mean, in terms of what's important to people, of course, the NHS is always high up there, isn't it, in elections, because it is so important to everyone. It impinges on everyone's life. And there's different polls, but the Ipsos Mori one earlier this year, people actually put the NHS as #1 concern, economy as #2, and inflation and cost of living as #3. So it's always going to be at the top or near the top.
Yeah.
Now, it's not working very well. And, satisfaction with the NHS in 2010 was 70% of the population. In the British Social Attitude Survey recently, it had fallen to 24%. So, something's gone wrong and there are things to be fixed. The problem is, what are the things which need fixing? And this is where I might differ from some other people, possibly yourself, in terms of the solution to the NHS's problems.
Is there a sort of short answer? I know this is obviously a very complex and rightly so issue, but is there this kind of one area that you think if only they did that, we could begin the journey of improvement?
Well, I don't think it is just one area, but I mean, there's a number of pressing things. I mean, you talk about the NHS consuming lots of resources, which it does, but actually in relation to other comparable European countries, we don't spend as much on a per capita basis. We spend about 18% less than the average in the EU14. And I don't think we spend enough. And I think for those who advocate some kind of change in model, they never look at actually what that would cost, and that would be a very expensive process, and it's likely to leave us with more expensive care at the end of the day. So funding is one thing. Staff is another thing.
Mm-hmm.
Now, there is a long-term workforce plan, but we need an absolute commitment to fund that and to make sure that it's actually carried through in practice. We don't have that at the moment. That's critical.
We need more doctors and nurses, right? I mean, that's absolutely pivotal.
More doctors and nurses.
Yeah.
I mean, Richard Sloggett, who is the policy advisor to Matt Hancock, produced a report last year and said that the government was in danger of missing the majority of its pledges it made around health. So he said they might meet 14 out of 35 pledges in relation to health. I don't think that will have got any better since he came up with that report.
Yeah.
And I think in terms of what should be done immediately, it is extra funding, and it's looking at social care, community support, primary care, mental health. Those things would be the absolute priorities. That's where the greatest pressures are at the moment.
We will watch with interest. John, we will speak again. Thank you. Dr Dan Poulter, co-chair of Keep Our NHS Public, who puts it right up there as #1. Do you concur? What policy would win your vote? 0344 499 1000.